Hello, and welcome to a new edition of Education is the Best Medicine. And thanks for watching. Remember, community access is your best bet. Thank Believe Radio. I want to thank Curtis. Hand to hand, we're trying to be a little bit better, start on time, the whole deal, right? Um, First of all, I want to say thank you. Thank you for the Facebook family, and I really appreciate all your support. And just again, thank you. Well, I'm George Pearson. I'm a PA. I'm a physician's assistant. I've been practicing about 35 years. And again, I want to welcome my Facebook family. And I'm really trying to keep those pictures of women with no clothes on off my Facebook thread. If you can help me do that, that'd be so helpful. I'm trying to make sure that doesn't happen, but here we go. But the content's been great. Enjoying that, enjoying people's conversations around all the things that they are into and worried about and thinking about. And I guess the thing about Facebook is almost like a dopamine rush, right? You keep hitting the buttons and it keeps going. So part of the fascination. Again, this is International Women's Day and Women's History Month. That's the show, and that'll be the theme for the rest of the month. This is my second show, and want to make sure we're on point with that. It's very important that we honor women, not only from a historical world and global standpoint, but also from the day-to-days of the Black women that have made what I am able to do and made my existence possible. Um, Kind of things were on my mind, measles. Measles? In 2024, as of March 14th, 2024, and this is from the CDC, in about 17 jurisdictions, Arizona, California, Florida, Georgia, the Illinois, Indiana, Louisiana, Maryland, Michigan, Minnesota, Missouri, New Jersey, right? New York City, Ohio, Pennsylvania, Virginia, and Washington all have reported an uptick in measles. And why do I bring this up? Is because this is why vaccinations are so important. And there was a drop in vaccination rate. They were usually doing around 96% of vaccination rates. That dropped to 94. Still, it appears not enough for herd immunity. And the concerns. What's measles? See, measles is also known as rubiola. It's a highly contagious viral infection caused by the measles virus. It primarily affects the respiratory system, but can also lead to serious complications, especially in young children, pregnant women, and individuals with weakened immune systems. This is why this is so important because um, folks in those groups are more at risk for adverse outcomes from the measles virus. Everything from encephalitis, meningitis, pneumonia, that kind of thing. And the issue is not that people get it; it's can they survive it? Um, Transmission: measles spreads through respiratory droplets when an infected person coughs on or sneezes. This is from GPT chat. You know, look it up, research it yourself. But I want you to kind of understand it. The virus can remain contagious in the air on surfaces for from two, and I've heard from 2 to 4 hours when a person with measles has that virus and it's exposed in the air. It can stay in the air for anywhere between 2 and 4 hours. And again, it has a high infection rate, like 90%. So a person comes in to a room or a baby into the room with a measles virus, it it can expose 90% of those people uh, to it and get them infected. Uh, and the big issues are, again, it can remain in the air as well as on surfaces, and this is why we need to continue to clean. Why I still wear a mask in clinical practice. The thing around cough, conjunctivitis, and coryza, which is kind of mucous membrane, nasally stuff. But again, the follow-up is that it gets worse, get a fever, and can put the person at risk for meningitis as well as pneumonia. So the initial symptoms of measles typically appear in 10 to 14 days after exposure to the virus and may include high fever, cough, runny nose, red watery eyes, that's the conjunctivitis, small white spots in the mouth, and they say that these white spots look like they been thrown on a dark background, which is the inside of the jaw, and it could be on the in the cheeks and roof of the mouth. They're called complex spots, and they herald the coming of the measles skin issue. So there's an enthatom, the internal exposure of measles. Then there's an exthamen, which is the showing of the rash. And the rash consists of a red raised bumps, usually develops a few days after the onset of symptoms, starting in the face and spreading through the whole body. You see these pictures on TV now, but then so they're in right in the middle of the measles exposure. Complications. And why am I talking about this? Because if folks, all of us, new moms, families, get vaccinated, then it literally prevents this from happening. And again, the groups that we're worried about, the elderly, the immune compromised, children, pregnant women, won't be affected. So complications. Measles can lead to various complications, particularly in vulnerable populations. These complications may include ear infections, pneumonia, encephalitis, which is an inflammation of the brain, and in some severe cases can cause death. No one should be dying from measles in 2024. Absolutely. Again, last time I was aware we had totally eradicated it. And I'm talking about in the last 5 years. There were some minor cases, but nothing than what we're seeing now. Prevention. So pregnant women who contract measles are at risk for miscarriage, preterm birth, and a low birth weight baby. The most effective way to prevent measles is through vaccination. The measles vaccine typically is administered as a measles, mumps, rubella vaccine. So you get these vaccines to the children. So the anti-vaxxers that don't want their children vaccinate, are a part of this issue. Probably a major part of this issue. I feel it's unfair to present this as a problem of folks migrating to the country that have not had vaccination. Although a large part, it's mostly folks that aren't vaccinated. Some of the cases were for unvaccinated children, but this in the resurgence is probably from unvaccinated kids. So the CDC recommends children receive 2 doses of the MMR vaccine, with the first dose given to 12 to 15 months of age, and the second dose at 4 to 6 years of age. Adults who have not been vaccinated or who are unsure of their vaccination status should also consider getting vaccinated. Let me read that again. Adults who have not been vaccinated or who are unsure of their vaccination status should consider getting vaccinated. I'm vaccinated. I had to show a vaccination record in order to work in the job that I'm working in now. It's not uncommon. You should do it. Outbreaks. Despite the availability of a safe and effective vaccine, measles outbreaks continue to occur, particularly in communities with low vaccination rates. These outbreaks can result from gaps in vaccination coverage, travel-related exposure to the virus, or transmission within close-knit communities. Global impact. Measles remains a significant global health concern. I didn't think I'd be saying that in 2024, but I'm saying it. Measles remains a significant global health concern, especially in regions with limited access to health care and vaccination program. Efforts to control and eliminate measles require coordinated vaccination campaigns, surveillance systems to detect outbreaks, and access to timely medical care for the affected individual. And what we saw that in place in the American medical system. Surveillance system to detect outbreaks, a discussion around campaigns for vaccination, and when children are sick, they're going to the hospital, or family members are sick, going to the hospital, and presenting with measles are getting the care that they need. In summary, measles is a highly contagious viral infection that can lead to serious complications, but is preventable through vaccination. Maintaining high vaccination coverage and public awareness of the importance of immunizations are essential for controlling the spread of measles and protecting the public health. And that's exactly why I'm having a discussion around this. We need to protect the public health. The homeless population is really at risk. Those with immune deficiency syndromes who are transplant survivors are at risk. Women that are pregnant are at risk. It's not good. And again, first dose of the immuno vaccination is again administered usually 12 to 15 months of age. So if you haven't vaccinated your child or has missed that vaccination schedule, you need to get back on it so the kids can be vaccinated. They're not going to outgrow this. In some cases, the vaccine may be given as early as 6 months of age. So we need to get all the children, all the folks back into this cycle of vaccination. Those that are not been vaccinated or need to be vaccinated, particularly my age group, I'm 68, 69, have to be vaccinated. Immune compromised, have to be vaccinated. And this is the reason why you can't, because you have an allergy to the particular product. So, however, this dose given before 12 months age is considered a zero dose. It does not count toward the routine 2-dose series. So you just have to take the vaccination in series. The second dose of mRNA vaccine is given 4 to 6 years of age before a child enters kindergarten or elementary school. The booster dose helps to ensure long-term immunity, provides additional protection against measles, mumps, and rubella. What parent doesn't want to protect their child? What parent don't want to protect their family member that's elderly or the mother that's pregnant? I don't think anyone wants to do that. So please, if you haven't, revisit vaccination. And COVID makes this all more prominent. So consult your primary provider. Make sure you have enough immunity in terms of vaccination against the chickenpox, measles, mumps, rubella. I had to revaccinate because my MMR, the measles, mumps, rubella, measles portion wasn't showing any titer, so I had to get revaccinated. So today's show was also a discussion about. So I went and looked at the top 10 medical problems through GBT chat, and it gave me a few things that I want to talk about because I think they're really important. And I'm going to be including them in my health talks and health concerns as the 10 concerns. The number one was physical inactivity. The second was food quality, and that includes obesity. And we also, because I want people to continue to exercise, we want to make sure folks understand about taking care of your hair before, during, and after the workout. I spoke with Anointing Hands, and she wanted me to convey and kind of clarify a few things about first of all, she wants to make sure that the women understand that there are many styles and protective styles that women of color can use to allow them to do exercise. And the way you can do your hair, you can do your hair in braids, or you can use you can have locks, or you can just have natural hair, and again, shaved head. It also includes, with the shaved head, wigs if you need it, and glueless lace wigs, which didn't understand it before, but basically when the wig is placed on the forehead, they use this sticky substance that keeps the hairpiece in place. Well, she's saying there's a product that is glueless that you can use. One, it helps with decreasing the irritation of the scalp and forehead during the workout, and secondly, it's easily removable. And again, she always thinks that the preparation, you have to prepare yourself to exercise. Of course, Unfortunately, women always have to prepare themselves for all these certain things. But again, this is their ability to exercise and take care of their hair. She mentioned the sweater and said you can use no rinse shampoos to clean your hair after you exercise, work out, and also scalp. She uses products like Sea Breeze, which is an astrident. And again, some of these products you should check, make sure you're not allergic to them. But it's one of the things I use in my hair care. Um, and and make sure you just don't have any allergies to the products. Check the sensitivities. She likes non-alcoholic based products, which can best be used. You can leave in conditioners, uh, things like almond and uh, some of the natural products. Uh, but again, you have to check and make sure you're not allergic to any of them. And this seems to be pretty popular. Uh, the use of braid sprays, as well as sulfurate as a protectant and help with the itchy scalp. Um, and in terms of general hair care, again, we're making a change in having the hair fit the lifestyle instead of the lifestyle fit the hair. And hey, when you can consult professionals like Anointed Hands to have a discussion about things you can do with your hair, for your hair, by your hair. And she also wanted me to say that she wanted to let sisters be sisters, and she gave us the prayer sign, and we'll be repeating this discussion on an ongoing basis because I think it's important that women not being able to take care of their hair as a reason for not working out. So back to the 10 things that we're looking at in terms of major health concerns. And obesity we talked about, tobacco use, abuse and addiction, and I'll put my little twist on that, of course, substance abuse, AIDS, HIV, mental health issues, particularly depression, falls and injuries, and immunizations, and also health access. Those are the top 10. Uh, and some of the chronic problems, and we'll talk about stuff like hypertension. But what caught my eye is major depression. And there's a young guy, well, not young guy. He's a professor at Stanford. He's the biology professor that also does a lot of stuff in brain and biology and neural and thought process and some of the major mood disorders like major depression and schizophrenia. He has some really intricate talks about it. And the reason I like him because it makes sense to me. And so he's having discussion around the biology and physiology of depression. And I want to also include adverse child experiences. And what are adverse child experiences? They're traumatic events or experiences that occur during childhood and can have long-lasting negative effects on physical health, mental health, and well-being throughout a person's life. I want to dedicate this show, part of it, to my son, who had endured a lot of trauma to be here and be back. And I'm so glad he's been released, and he's working on himself, and we're working on our relationship. I'm excited about that. So adverse child experiences are typically categorized into 3 types: abuse, physical, emotional, or sexual abuse inflicted by a parent, caregiver, or another person in a position of trust or authority. Neglect, physical or emotional neglect, including failure to provide a child's basic needs such as food, shelter, supervision, and emotional support. Household dysfunction, exposure to household dysfunction or instability such as witnessing domestic violence, living with a household member who has a substance abuse use disorder, mental illness, or who is incarcerated, or experiencing parental separation or divorce. I don't know if anybody that had this. I can't think of anybody that I know that's honest that hasn't had this. And that means we have to re-look how trauma has affected us and affected our children. and affected our communities and affected our systems. And when you throw racism, sexism, and class into it, you have a gumbo of affirmities. Advanced childhood, adverse childhood experiences can have a profound impact on child development and can increase the risk of various health problems and adverse outcomes later in life. So why are we having this? Because why what it, what might have been adverse to you could have been standard child raising practices to me. Has to be painted under the lens of the culture, of race, of sex, of economic opportunity, of social determinants. All those things play a role in this. And one of the biggest things and one of the biggest problems we have is not being able to understand the difference and address those things, address and meet those needs. We're too busy blaming, and blaming has no place in this discussion. So, adverse childhood experiences. Remember, this is still Women's International Women's Day and Women's History Month. So paint this lens and what happens to women of color from 1619 on, and what happens to women on a general basis. And I'm not playing a violent lens. I'm just saying what happens and how, as a male construct, we need to change this, because right now the construct is abusive. The construct is sexualized. And I'll say I really, my heart goes out to the women in FCI Pleasanton who have been under a mantle of sexual abuse and traumatization while being incarcerated. That's what I'm talking about. And all the things in between that make those women in that situation powerless, and also the objects of control and domination by a male staff. And not necessarily a male staff, but those that buy into the concept that those women don't deserve rights or have a role to play or should have dominion over themselves. It's the same thing that's being played out in the abortion issue. Men are deciding women's right to have children and where they can have children and how they can have children. Not that much difference. So, average child experiences are associated with increased risk of chronic health conditions such as heart disease, obesity, diabetes, and certain types of cancer. The toxic stress resulting from adverse child experiences can dysregulate a body's stress response systems, leading to long-term changes in its physiological function. Paint that picture from 1619 on, and how the very way you were living changed how you would grow and how you would develop and how you would learn and how you would be. Layer that on being a woman times 10. Mental health disorders are strongly linked to the development of mental health disorders, including depression, anxiety. I told you this all interacted, all interlaced, all the discussion, because the same things keep coming up. If you've noticed the conversations, they're not separate. They come up as now integrated. That's what healthcare has to be. It has to be integrated now. You have to understand that the effects of childhood trauma can affect my ability to control my hypertension, my diabetes, to lose weight, to have a functional sexual relationship, to get along with my child. All that is a part of this. And we need to change it. So that's why I'm talking about it. And so childhood trauma can disrupt normal brain development and increase vulnerability to psychiatric conditions. It's common in depression, anxiety, post-traumatic stress disorder, substance use disorders, and suicidal behavior. I've always said, if you don't handle the mental health concern, you can't handle the psychological concern. excuse me, if you can't handle the mental health concern, you can't address the medical concern. Because the endpoint, believe it or not, I'm gonna say it again, is heart disease, heart attack and stroke, cancer. Endpoints to trauma. Social and behavioral problems. Again, this is Believe Radio, 24-hour inspirational gospel music. I want to thank Miss Barbara Howard, Conscious Voices. This is the leadership piece of that, along with Etymology and Curtis. Curtis, thank you very much for your work and doing what you do to help me pushing this ball up the hill. Social and behavioral problems with adverse child experiences can contribute to social and behavioral problems, including difficulties in forming healthy relationships, engaging in risky behaviors such as substance abuse, unsafe stress practice, involvement in criminal activities, interpersonal violence. Individuals who experience adverse child experiences may be at higher risk for penetrating or becoming victims of violence later on in life, perpetuating the cycle of trauma across generations, intergenerational trauma. I've talked to you about this. Now we have the literature to support it. It's just not us. It's what's happened to us. It's how we've been scripted. We're still having conversations that we're having in 1619, whether it be the right to vote or the right to have children, or a right to a fair wage, or right to respect. On a side, Facebook, a lot of the discussions are talking about, on one hand, men that are wimps and women that want privilege. And it's kind of like a bouncy back, I get that dopamine rush, and you got this strong brother, you got to do this to the woman because you're gonna, and then that way, I want this and this and this, and I want $100,000 wedding, and because she said my standards are high. That's what she said. Her standards were high, so I didn't know $100,000 wedding that this brother would have to pay out would be where we would go with this if you're talking about love and commitment. And a lot of sisters came on to their to acknowledgement, said they got married for $50, $25, and now they got big house and big all that kind of stuff. Because we don't want delay, you don't want delayed gratification. Don't want to delay it. And poor academic occupational outcomes. Again, adverse child experiences can impair cognitive development, academic achievement, job performance, leading to lower educational attainment and reduced economic opportunities in the adulthood. Yeah, that's adverse child experiences. It's just starting to permeate through the discussions in healthcare and become a valid piece of discussions about why people are the way they are and how we need to change our treatment modalities to fit who and what we're seeing and why they are the way they are, as opposed to what we want them to be. And recognizing and adjusting adverse child experiences is a crucial for promoting the health and well-being of children and adults. Prevention efforts should focus on early intervention, trauma-informed care, strengthening family and communities, providing services for individuals who have experienced trauma, implementing policies to address the root cause of childhood adversity. By addressing adverse childhood experiences comprehensively, we can help break the cycle of intergenerational trauma and promote resilience for healing individuals in the community. That's a lot. And just think, over the last 20 years, it was our problem. We weren't doing well as African Americans because we were lazy. We didn't want to work. We didn't want to accept the back of the bus. That was our problem. We didn't want to accept less. I always tell folks, you want to measure society, measure how educated the society is. The discussion is, do you want me to read and write so I can communicate in this environment you call America? Well, no. We had a law at one point that said if you taught an ex-slave to read and write, you could be whipped or killed for teaching someone how to read. Intergenerational trauma. And one of the big things, I wanted to bring it up, depression. Because that's what this ends up being. Depression, schizophrenia, bipolar, anxiety, ADHD. And I took another slice out because we can do this in the material and we can slice it and really see inside of the inside. So general depression of Americans, yes. Let's talk about African American women. The prevalence of depression in the United States has increased significantly in the past decade. It has affected African American women disproportionately due to reasons such as lack of access to mental health care. One of the problems, right, in the complaints, 10 of them, was access. We talked about access. Nothing we're talking about here is new, just validation. And disproportionately due to reasons such as lack of access, mental health care, and living with psychosocial stressors such as racism and discrimination. I didn't say that. That's what the CDC is saying. I'll read that again. Lack of access to mental health care and living with psychosocial stressors such as racism and discrimination. And if the person that is providing your care is a racist or discriminatory, you won't get good care. You can't. According to the U.S. National Survey of American Life, which included 1,400 African American women and 341 non-Hispanic white women, the prevalence of depression in African American women was 21.3%, which is significantly higher than the prevalence of depression among non-Hispanic white females, which was 10%. More than 50% increase just being a black woman makes you more depressed. And why shouldn't you be? If your concept is what can you do for me, if your concept is entitlement, if your concept is Barbie, it's not going to work. We came through a slave system. We were traumatized. Another study consisting of predominantly African American women reported that 33% of their participants had moderate to high levels of depression. Again, if it's the mental issue, if you don't fix the mental issue, you can't fix the medical issue. So we can't address depression in our community and African American women and make it something that we want to address as with the men. It's the same numbers. It's the same issue. Because we have a reason to be depressed. Don't you think don't you think the institutional and structural racism would not make you depressed? It should. It has to. Any human being that does not make them depressed, something's wrong with them. Accepting abuse, accepting traumatization, driving while black, traveling to the state for jobs. And again, they found 49% of African American mothers that experienced depressive symptoms following the birth of a child, postpartum depression. We should be looking for women and understanding women throughout the cycle of the pregnancy and after the pregnancy need care. If you're telling a woman to have a child and do not want to put these in place, you are committing her to depression, suicide, and self-harm of the child. That's what you're committing to. So what I want folks to understand that sometimes the pregnancy event for a woman is the opposite of what everyone says it is, or what they think, oh, I love the baby, but no, they're depressed and they feel like not themselves. Their body's dysmorphic. Their husband's not attracted to them as much as they was before. She feels not herself. And being told to go back to work, get over it. That's why FML. That's why you need family and medical leave, so that woman can bond with her child, so the father can bond with the child, so they can have a family unit. If that's what you're talking about, if this is the America, the white picket fence, then you have to give time for that to grow, just like anything else. But they're not. So common stuff around depression is anhedonia. Just you can't find the pleasure in things. And it's not just, boy, I'm sad. It's an ongoing piece for at least 2 weeks. And the longer it goes on, the more depression you fall into. It's just the absence of pleasure, guilt, grief for not getting up off the bed and running down the street and being happy and making love to your partner and all the bubbly stuff. Not there. I could say this. Women of color during slavery had to endure a lot. And this whole Aunt Your Mama, Big Bertha mindset wasn't about women that didn't want to take care of themselves. It was about women that did not want to be attractive to the master. And it didn't work. But the imagery did. I think it's kind of weird that Little Miss Butterworth, I think she don't even do her anymore. She's a little figurine bottle, African American woman, and they thought that was racist. So what do? Oh, no, Aunt Your Mama. They gave her a perm. She went from a wrap-up bonnet piece to a perm. I guess that was supposed to be okay. It didn't sit well with me. Anyway. And not only people don't they have pleasure, not only do they feel guilty, they can't think right. They think slower. It's hard for them to put thoughts together. And we're not just talking about remembering where the keys are at. We're talking about, did I take a bath? Did I, go get something to eat? Hey. And the brain patterns are slower. And the issue around suicide and self-harm. And I was listening to Dr. Sapoloff, and he was saying that, the suicide risk doesn't come with the person in the hospital, basically. It comes with that person that may be a little on medicines and starting the family scene. They start to feel better. In reality, their mood is moving up from that depression so that they can commit suicide. Never thought of it that way. Women's suicide is called for help. Men try to do the deed. And now it's kind of switching up. Women are doing more lethal methods of killing themselves. The prototype is the older white male, low education, who has access to a gun. That's supposed to be the prototype. We're worried about the African American men and African American women. Again, this is the literature. Decreased interest, and appetite changes, more or less, concentration, energy decrease. I'm always tired. Since depression is a significant health condition that can lead to substantial death and sickness. It's mortality and morbidity. Those are the big words. An overview of the scale of depression in terms of mortality and morbidity. While depression itself may not directly cause death, it is associated with an increased risk of mortality from other causes, particularly suicide. Depression is the leading risk factor for suicide. Individuals with untreated or poorly managed depression are at higher risk of suicide thoughts and suicidal behaviors. According to the World Health Organization, almost 800,000 people die by suicide every year globally. Depression is often a contributing factor. In fact, 90% of the individuals who die by suicide had diagnosable mental health conditions such as depression, therefore lack of access. Depression is also associated with an increased risk of mortality from other healthcare conditions, including cardiovascular disease. Oh yeah, you eat bad, you don't get exercise, blood pressure goes up. You have a heart attack or stroke from eating all the sugar foods. Because again, you're eating stuff, you're eating all the bad stuff because that's what gives you pleasure. Because the regular food doesn't give you pleasure, it doesn't make you feel good. It's the sugar highs and lows. It's the fat highs and lows. It's the substance highs and lows, which leads to heart disease, which leads to stroke, which leads to diabetes, and certain types of cancers. And it may be due to the impact of depression and lifestyle factors. Poor diet, substance abuse, all interconnected. All these things are interconnected. So the top 10 concerns of people, if they were to come into the office and see me, are all interrelated. It'd be hard not to hit a bullseye. So in other words, hey, Mr. Pearson, I'm depressed. Oh, heart disease, cancer, lack of activity, risk of hurting or harming themselves, as opposed to the person's just depressed. Social factors. So, depression is associated with increased risk of mortality from other health conditions such as cardiovascular disease, stroke, diabetes, and certain forms of cancer. It may be due to the impact of depression and lifestyle factors such as physical activity and poor diet, for instance. Morbidity. Depression is the leading cause of disability worldwide, significantly impacting individual quality of life and function. It can infer with daily activities of work performance, relationships, and overall well-being. The symptoms of depression, as we talked about, are persistent sadness, loss of interest, loss of interest in pleasure and activity, changing in appetite or weight, sleep disturbances, fatigue, feelings of worthlessness or guilt, and difficulty concentrating can vary in severity and duration. Everybody's different. Depression often occurs with other mental health disorders such as anxiety disorders, co-occurring disorders. Depression and anxiety. People that are depressed are anxious. Some people that have anxiety have depression. There could be co-occurring disorders, separate from themselves, totally unique. One has a person going down, one has a person going up, and not be bipolar. It's as a separate, major depression and anxiety. And addressing depression requires a comprehensive approach that includes early identification, access to effective treatments such as psychotherapy and medicine. Although one of the common issues that we think that anxiety and depression, we get people to what's called a cognitive behavioral therapy program. If they do have to take medicine, they have to take less. And efforts to reduce stigma and discrimination associated with mental health illness. Lots of that in our community. Lots of that in community college. Lots of that from women because they feel like they can't be sick. They can't have an issue. Increasing awareness of depression, promoting mental health literacy, and investing in mental health services are essential steps in reducing the impact of depression on individuals and the society. Some of the medical concerns that we, again, hypertension, high cholesterol, coronary disease, diabetes, substance use disorder, alcohol abuse, COPD, psychiatric disorder, Crohn's disease, and GI disease. We're going to talk about these, but again, the top 10. Again, physical inactivity is indeed a prevalent issue in the United States, and effects on health can be substantial. Here are some of the key issues around that. Obesity. Physical activity is a significant contributor to obesity, which in turn increases the risk of various health processes, type 2 diabetes, heart disease, stroke, and certain types of cancers. Cardiovascular health. Lack of physical activity is linked to poor cardiovascular health, including high blood pressure, elevated cholesterol levels, and increased risk of heart disease and stroke. Musculoskeletal problems. Sedentary lifestyles can lead to weakened bones and increase the risk of conditions and like osteoporosis and fractures, and the risk of falls and the risk of fractures. So we want people to move even when you have injuries because it helps. It raises your endorphin levels and it does help with strength. Mental health. Regular physical activity has been shown to help positive effects on mental health, including reducing symptoms of depression and anxiety. Conversely, the lack of exercise can contribute to mental health issues. Now, I've tried to be a seeker of solutions. And we started this with a discussion of the top 10. We started this with a discussion around care. We started this around a discussion around women of color and the effects of structural and institutional racism. Again, physical inactivity, chronic diseases, physical inactivity is associated with increased risk of developing chronic diseases such as type 2 diabetes, certain cancers, colon cancer especially, and metabolic syndrome, which is a pre-form of diabetes, but puts you at cardiac risk. Shortened lifespan. Studies have shown that a sedentary lifestyle is associated with a shorter lifespan. Regular physical activity, on the other hand, is linked to longevity and a reduced risk of premature health. No pills, no program, just plain old walking, exercise, stationary bicycle, swimming, yoga, African dance, so many things you can do. And healthcare costs, quality of life, physical inactivity can negatively impact overall quality of life by reducing mobility, increasing fatigue, and limiting participation in activities of daily living. Health costs. The health consequences of physical inactivity contribute significantly to health costs in the United States and the world, including expenses related to the treatment of obesity, chronic diseases, and associated complications. Addressing physical activity through promoting regular exercise and active lifestyles is crucial for improving public health outcomes and reducing the burden of preventable diseases in the United States. We've got about 15 more minutes left, and I want to kind of have a discussion, and we dig into the numbers again. I try to dig into the numbers and make this. So, according to data from the Center of Disease Control Prevention, physical inactivity rates tend to be very based on demographic factors such as gender and race and ethnicity. While there isn't a single estimate for women and women of color, we find women overall. Women overall reports that approximately 25.8% of women are physically inactive, meaning they do not meet the recommended guidelines for aerobic and muscle strengthening activity. These guidelines typically suggest that at least 150 minutes of moderate to intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activity of 2 or more days per week. Nope, no other women are doing that. You see them on the Peloton commercials, but folks are actively doing this, and they're getting good results from it. Non-drug solution. Women of color physical activity rates vary among different racial ethnic groups. Black women or African American women, studies have shown that Black or African women have higher rates of physical inactivity compared to women of other facial ethnic groups, such as socioeconomic disparities, to include resources, cultural norms that may contribute to this difference, including hair. That's what we're talking about. Hispanic and Latino women, physical inactivity, which some Hispanic or Latino women may be also very influenced by factors such as acclimatization, language barriers, and neighborhood environment. Asian American and Pacific Island women, these data especially focus on physical inactivity rates among Asian and Pacific Islanders may be limited in studies because they don't study them. They're not studying those women. And we want to address physical inactivity by activity, education, awareness, building an environment, workplace wellness program, school-based innovations, policy changes at the state and local level to support physical activity, community programs, establish community-based programs, technology and innovation, healthcare integration. That's why you got a smartwatch. Oh, and I thought I wasn't going to get to it, but happy St. Patrick's Day. Well, St. Patrick's Day. I want to get America moving, and we know that that's a large number, 25%. And for women that are active, 25% of our population, that's terrible. And we have a number of problems related to inactivity, thereby weight gain, thereby chronic disease. And it's simple. In that context, again, I'm honoring St. Patrick's Day. Oh, what's St. Patrick's Day? And how does it relate to women? International Women's Day and Women's History Month. Well, pretty significant. Let's talk about it. St. Patrick's Day is observed on March 17th, and the cultural and religious holiday commemorating St. Patrick, the patron saint of Ireland. It's celebrated not only in Ireland, but also in countries around the world, particularly those with Irish populations. I didn't see anything about alcohol. I thought it was a celebration of the patron saint. St. Patrick's Day has become associated with various traditions and customs, including wearing green clothing or accessories, attending parades, participating in festive events, and enjoying Irish food and drinks. Oh, drinks. In Ireland, St. Patrick's Day is a public holiday marked by religious services, parades, and family gatherings. The holiday was named after St. Patrick, a 5th century Christian missionary who is credited with bringing Christianity to Ireland. The legend is that St. Patrick used 3-leaf shamrock to explain the concept of the Holy Trinity to Irish people. Over time, St. Patrick's Day has evolved into a celebration of the Irish culture and heritage, featuring symbols such as shamrock, leprechauns, and the color green. It is a day it's a day marking Irish descent, as those who enjoy simply the festivals to come together and celebrate joy and merriment. So, St. Patrick's Day is a celebration of white folks and their patron saint. So when you're celebrating St. Patrick's Day, I want people to know why they're wearing green and why they're doing. It's in homage of a patron saint, not the guzzle. Okay. So it brings me to my second discussion in terms of substance abuse, and particularly alcohol abuse. And we'll cover some other of the abuses, but remember this session is about substance, primarily alcohol, tobacco, and its relationship to other additions like food, sex, and how trauma affects us. So let's look at it. Alcohol use in women, and not just alcohol use, abuse. I'm getting to a point that even alcohol is giving some of the effects it is having over young women on to age 20 over. It's concerning, It's concerning me that it doesn't mean I don't believe in freedoms or news or liberation. It means that you can have heart disease, liver disease, and cancer, and a risk of being raped or traumatized. Sometimes I want women to start thinking about that because that's the risk issue. Alcohol abuse is often referred to as alcohol misuse or alcohol use disorder, is typically defined as the pattern of drinking that leads to significant impairment or distress. Diagnosis, statistical dosage, and manual DM5. This is the definition. When it comes to alcohol use and abuse among women as well as women of color, it's essential to consider various factors such as the prevalence patterns, consumption associated with health concerns, while specific data on alcohol use among women of color may vary on demographics and geographical location. There are some general trends and statistics on St. Patty's Day as you go out to get ready to celebrate. Prevalence of alcohol use. According to the National Institute of Alcohol Abuse and Alcoholism in the NIAA in the United States, approximately 58.8 women aged 18 older report drinking alcohol in the past month. The data from the Substance Abuse and Mental Health Services shows that the rates of past month alcohol use vary differently between different racial and ethnic groups of women. For example, the past month alcohol use rate among white women is typically higher than among Black or African American or Hispanic or Asian women. Binge drinking. Binge drinking defined as consuming 4 or more drinks in a single occasion for women. Is because I'm bringing this up because watching Facebook, all these women are drinking. A lot of women are drinking. Kind of concerning. Imagery, everything. Binge drinking defined as 4 or more drinks on a single occasion for women as a concerning pattern of alcohol consumption. I think that's too many. It should be less than 2. The prevalence of binge drinking among women varies by demographic factors, including age and socioeconomic status. According to CDC, approximately 18% of women report binge drinking. Alcohol use disorder. Alcohol use disorder is a problematic pattern of alcohol use that leads to clinical and significant impairment and distress, according to the NIA. 5.1% of adult women in the U.S. have alcohol use disorder. Health consequences. Alcohol of chronic alcohol use can lead to various health consequences for women, including liver disease, cardiovascular disease, neurological disorders, and an increase in breast cancer. An increase in breast cancer, ladies. Pregnant women who also consume alcohol are receiving birth to babies with fetal alcohol syndrome and disorders. And the men have to stop too. If we're feeding into this, then we need to stop it too. If you're drinking, your partner's going to drink. There's no ifs, ands, buts about that. That's usually what happens. If you're not stopping men, then the women aren't going to stop. So don't complain. Barriers to your treatment, including women of color, may face unique barriers to access alcohol treatment services, the stigma, cultural norm, social, economic factors, inadequate health concerns, and women make more money, so they can buy this alcohol now. They can buy the brown. You know. Anyway. And I think it's important for women, a general statistic experience of women and women of color with alcohol use of abuse are diverse and multifaceted. Tailored intervention support services for all of the women. And some of the things around impaired control, drinking more alcohol for a longer period than intended, unsuspected tips to cut down or control drinking, social impairment, continued alcohol use despite social or interpersonal problems caused by exacerbated drinking, risky use, engaging in risky behaviors while drinking, such as driving under the influence, using alcohol in situations where it's typically hazardous, or having legal problems, tolerance, need to increase the amounts of alcohol to achieve the desired effect or experience the diminished effects with continued use of the same amount, withdrawal symptoms, experience withdrawal symptoms, and disclaimer, yeah, I used to drink, but I don't now. My pancreas can't stand it. And it isn't the look that I want to have. Simple as that. And women have some physiological differences. Women tend to have lower body weight, water content, and lower levels of enzyme called alcohol dehydrogenase, which then metabolizes alcohol. As a result, women generally experience higher blood alcohol concentrations than men are after consuming the same amount of alcohol, putting them at greater risk for alcohol-related harm. You're just lighter, ladies. Social and cultural factors. Women of color may face unique social and cultural factors that influence their alcohol use patterns and the consequences of alcohol abuse. These factors make depression, anxiety, trauma, including historical trauma, discrimination, socioeconomic disparities, access to cultural competent healthcare services, and I can't find a real man anywhere. I'm just kidding. That's what they're saying on the internet. Wow. Intersectional ideas. Women of color may experience intersection forms of oppression on race, gender, and other identities, which compound the effect of alcohol abuse. There are women living in a man's world. There are women living in a man's world. And the last thing I think that I thought was really, really important, and it's the issue of alcohol and sexual assault. And serious sexual assault half the sexual assaults are associated with either the perpetrator, alcohol consumption, the victims, alcohol consumption, or both. I'll read that again, ladies, as we get ready for St. Patrick's Day and libation. Almost half of the sexual assaults are associated with either perpetrator's alcohol consumption, the victim's alcohol consumption, or both. Neither one should be drinking, right? Beliefs about alcohol, certain personality traits, physiological mechanisms, victims' consumption, childhood trauma. It's essential to recognize the complexity associated between sexual assault and alcohol use, particularly as it relates to women of color. The literature just showed that statistic. Either they're drinking, the guy's drinking, or partner's drinking, or they're both drinking, which is an altered space. Well, I want you guys to have a great St. Patrick's Day. I want to thank you for watching the show. I really appreciate the support. I think that as we continue to grow on this, and we're going to tackle some more issues in this Big Ten, but they're all interrelated, all interspersed. And we want to talk about lifestyle changes and changes that can make you better as a person, as an individual. I want to thank you for tuning in. I want to thank all the love and support, all the people that continue listening and follow the page. We're going to be launching Education the Best Medicine. Me and my son are going to start having these conversations about improving that platform so we have an ongoing dynamic and places for you to go for some of this information. I want to thank you again. Thanks for all you folks for listening, and we'll see you in 2 weeks. Next week is Miss Howard. Thanks, Miss Howard.